Hello everyone. This lecture today about the anterior and medial compartment of this eye. So we are going to talk about each compartment and the muscles of this compartment and nerves and arteries. The compartment of this eye, as we mentioned before, we had three compartments: the anterior compartment, the posterior compartment, and here is the medial compartment. So this is a cross section through the leg, through the thigh, showing here this is a femur bone, and this is the skin, this is the deep fascia, and here this is intermuscular septum connected to the bone and dividing the thigh into compartment. So the anterior compartment, it's innervated by the femoral nerve. Posterior compartment is by the sciatic nerve, and the medial compartment is innervated by the obturator nerve. Again, here this is the anterior compartment, and you see the different muscles of the anterior compartment, and this is the posterior compartment containing the hamstrings muscle, and this is the medial compartment. So let's talk first about the cutaneous supply of this skin of this eye. Mainly focus here anterior and medial, as we discussed the posterior in the previous slides. So if we look here, this is the anterior thigh. We find this small area here is innervated by the genitofemoral nerve, by the femoral branch of the genitofemoral nerve. Okay, so the femoral branch of the genitofemoral supplying this small area here just below the inguinal ligament, and the most area of the skin is innervated by the anterior cutaneous nerve of this eye, which branch of the femoral nerve. Medially, here we have the obturator nerve, also the cutaneous branch from the obturator nerve supplying this small area here, and above here it's supplied by the ilioinguinal nerve, and the lateral part, it's innervated by the lateral cutaneous nerve of this eye, supplying this area here. This is slide showing the dermatomes of this eye, the segments, spinal segments, as we see here, L1 supplying the area over the inguinal ligament, and then L2, L3, L4, 5 here in the region of the leg. So in the thigh we have just L1, L2 and L3. So what about the superficial structure? If we remove the skin, we can see this superficial structure containing what? Superficial vessels, arteries and veins, and then also we had a superficial great saphenous vein, we had cutaneous nerve, and we had the superficial lymph nodes. Regarding the superficial vessels, can be shown here. This is the superior or the superficial epigastric vessels, and here these are the superficial, external epidendal vessels, and these are the superficial circumflex iliac vessels, and this vein is the greater saphenous vein, and these nerves here are the cutaneous nerve, and also we are going to see some lymph nodes spreading here and here. As we see here, this is the greater saphenous vein, which is the longest vein found in the body. Very important to know the course of this vein, started from here, go to the leg and go posterior to the knee, and again go medial till it ends at the femoral vein here. This is the superficial epigastric vessels, external pudendal vessels, and this is the superficial circumflex vessels. These other cutaneous nerve that we already spoke in the first slides. Here, this is the superficial inguinal lymph node, and this one are the deep inguinal lymph node. The deep going here with the vein and arteries, and the superficial run superficially and horizontal, where the deep are vertical alignment. Here this is show the muscles of the anterior and medial thigh. As we can see, that is the psoas muscle, started from here, iliacus muscle, and these are the pectineus muscle, and these are the adductors muscles. Here we can see this is the sartorius muscle, and here this is the rectus femoris muscle, and this is the vastus lateralis and the vastus medialis. And beneath this muscle we have also vastus intermedialis. So let's speak about the muscles. We have the sartorius muscle, the iliacus, and the psoas muscles. Sartorius, it's originated from the anterior superior iliac spine. It's inserted at the upper medial surface of the tibial shaft. It's innervated by the femoral nerve. So the main action is flexion and abduction and lateral rotation of the thigh. It also have another action on the knee because it's passing and crossing the knee, so it's flex and medial rotate. This muscle can be named as the tailor muscle because the tailor, while sitting for his job, he is flexing both hip and flexing his knee with some lateral rotation of the thigh and a little bit medial rotation at the knee. So it's called the tailor muscle. Iliacus muscle, it's originated from the iliac fossa and inserted at the lesser trochanter. Innervation is by the femoral nerve. The main action is flexion of the thigh. If the thigh is fixed, it's flexing the trunk, and the vice versa. So when the trunk is fixed, it is flexing the thigh. It share action with the psoas major. The psoas major, it's originated from the 12th thoracic vertebral body, transverse processes, and intervertebral disc of all lumbar vertebrae. It's inserted together with the iliacus at the lesser trochanter. It's innervated from the lumbar plexus from L1, 2, and 3. It flexes the thigh and flexes the trunk on the thigh if the thigh is fixed. The same action of iliacus. So we can see here, this is the iliacus muscle and this is the psoas muscle, okay? So iliacus and the psoas. Sometimes here we can see the psoas minor, but it's not included here in our talk of the lower limb. So this is psoas major and iliacus muscle. Another muscles are the sartorius muscle. As it originated from the anterior superior iliac spine, inserted here as the medial tibial tuberosity, and it's the longest muscle in the body, and its action on the hip and the knee joint. This small pectineus muscle here. The pectineus, it originates from the superior ramus of the pubis. It's inserted into the upper end of the shaft of the femur and innervated by the femoral nerve. It's flexing and abducting the thigh. We had the rectus femoris muscle. It has two heads, the straight head and the reflected head. The straight head from the anterior inferior iliac spine, versus the reflected head from the ilium, just above the acetabulum, inserted into the patella, innervated by the femoral nerve, action, extension of the knee, and flexion of the hip. The vastus lateralis, it's upper end of the shaft of the femur. It's inserted into quadriceps tendon, into patella, innervated by the femoral nerve. Action is extension of the leg. Again, this picture here, this is the sartorius muscle, and this is the rectus femoris. It has two heads, straight head and the reflected head. This muscle here is a pectineus muscle. This is the vastus medialis and the vastus lateralis here. So both the vasti muscles are innervated by the femoral nerve. So the femoral nerve provides innervation for most of the muscle of the anterior compartment of the thigh, and this femoral nerve, after giving this muscular branch, it will continue as a saphenous nerve, which a cutaneous nerve supplying the skin over the leg here. And as we see, it's accompanied here by the vein, which is the greater saphenous vein. So this muscle forming a specific triangle at the top of the anterior thigh, which we call it the femoral triangle. This triangle, as you see here, it has the boundaries. The superior boundaries is made by the inguinal ligament, as you see here, okay? Then the medial boundaries is by the adductor longus muscle. Adductor longus muscle here forming the medial boundaries. And the lateral boundaries is by the sartorius muscle. So the roof of this triangle is made by fascia, fascia lata, and the cribriform fascia. So skin, fascia lata, and cribriform fascia. And the floor of this triangle is made by iliopsoas, pectineus, and adductor longus. Can see here from lateral to medial. The first one laterally, the most lateral is the iliopsoas, then we have the pectineus, and then we had the adductor longus muscle. So what are the contents? The contents of this triangle including the femoral nerve, which is found a little bit laterally, the femoral artery in the middle, and the femoral vein medially, and lymphatics. So the lower three, the femoral artery, vein, and lymphatics, are enclosed by the femoral sheaths, but not the nerve. This can be explained because the femoral sheath is formed by two fascia, the transversus fascia, fascia transversalis, and the iliac fascia, iliac muscle fascia. So when this fascia meet, the fascia transversalis is forming the femoral sheath, and this femoral nerve comes behind the iliac fascia, and this is why the nerve is excluded out of this fascia or this sheath. From this is the inguinal ligament again, and you see this projection from the inguinal ligament, which is the lacunar ligament. And here is the femoral ring. We are going to talk about it in more details. And this also lymph nodes that can be seen inside the femoral canal. So this is a ring, and this ring will go to the femoral canal. So again, the contents is the femoral nerve, the femoral artery, the femoral vein, the femoral canal, which containing the lymph node. And the femoral sheath clothing these three structures. Here this is a slide showing the formation of the femoral sheath from the transversus fascia and the iliacus fascia. And you see this is the nerve, the femoral, going out of this fascia. So let's talk about the femoral canal, which is a canal found medial to the femoral vein. This is the nerve, artery, vein. Medially here we have the femoral canal. The femoral canal length is about 1.3 centimeter in length, and its upper opening, we call it the femoral ring. The boundaries of this ring is inguinal ligament, which is found here anteriorly. Medially here we had the lacunar ligament. Posteriorly here we had the pectin or the pubis, we can see the bone. And laterally here we had the vein forming the lateral boundaries. So the content of this canal is loose fatty tissue and small lymph nodes and lymph vessels. The importance of this canal is the femoral herniation, which is common in female. It's herniation through this canal, and usually it's found it lateral and below to the pubic tubercle, which can easily differentiate it from the inguinal hernia. Here this is the saphenous opening. We call this saphenous opening because here the greater saphenous vein came and drained into the femoral vein. Another structure also we had in the anterior side is the adductor canal. Adductor canal, or another name is the subsartorial canal, because it below the sartorius muscle, or the hunter canal. All of these are the same names for the same canal. So it extends from the apex of the femoral triangle, at the apex of the femoral triangle, which is facing downward, to the adductor hiatus, which is an arch between of the adductor magnus muscle. So it's bounded by the vastus medialis laterally. There is a vastus medialis here. Laterally, this is the vastus medialis muscle, and here laterally. And adductor longus and magnus here, which are forming the posterior boundaries. And the muscle here, cut it, this is the sartorius, cut it and removed, should be above these structures, which is founded anteriorly. So these are the boundaries of the adductor canal. The content, it contains the continuation of the femoral nerve, which is the saphenous nerve. It also contains the femoral artery, the femoral vein, and lymphatics and nerve to vastus medialis, and some loose connective tissue. Again, this here the contents of the adductor canal, the femoral artery and vein, nerve to vastus medialis, the saphenous nerve, and here these are the boundaries. The sartorius, which has been cut, it is anteriorly, and we have the adductor magnus, longus, medially, and the vastus medialis here laterally. So let's move to the muscles of the medial compartment. The muscles of the medial compartment include the adductor longus, adductor brevis, adductor magnus, gracilis, and obturator internus. So this is the adductor brevis, and here this is the adductor longus, and this is the adductor magnus, and the last one is the gracilis muscle, and the obturator externus, which we can see here behind the pectineus muscle. Okay, so these are the muscles of the medial compartment. The very important nerve that's applying this muscle is the obturator nerve, which came here and passing through the obturator foramen. There is a small groove here for these nerves and vessels. We call it the obturator groove, and then emerge here and supply the muscles of this area and give a cutaneous supply to the medial small section of the thigh. These muscles, adductor brevis, longus, magnus, and obturator, all of them take, and the gracilis, all of them take innervation from this obturator nerve. And very important to see here, this is the adductor hiatus, very important arch which is made by this adductor muscle, and from here the end of the subsartorial canal or Hunter canal, and also represent here the end of the vessels, the femoral arteries end here and change its name to artery, and also the popliteal vein, when entering here, it change into femoral vein. Okay, so it's a very important point, this hiatus. So this is the muscles. So it's once in our medial compartment, so main action is abduction of the thigh, and also the gracilis help in flexion and medial rotation also. The adductor brevis, it helps also in flexion, but the main action of this muscle is abduction. The adductor magnus, it has, as we mentioned, two parts, adductor part and the hamstring part. An adductor part is flexes the thigh, where the hamstring part extending the thigh. Yes. So an adductor part is innervated by obturator nerve, and the hamstring part is by the tibial portion of the sciatic nerve. Obturator externus, it is innervated by the obturator nerve, and it's laterally rotate the thigh. Very important to notice the action here, the lateral rotation of the thigh, and it's steady, stabilize the head of femur in the acetabulum, another additional function. So the branches of the femoral artery, as we see here, it's giving these branches. The deep femoral artery, or the profound femoris artery, which provide this perforating arteries to supply the posterior thigh, and then at the adductor hiatus it terminate and change into popliteal artery. And here also we have another distal branches. Thank you so much for your attention.